Hello, I'm Dr. Stephen Nimer. I'm the director of Sylvester Comprehensive Cancer Center at the University of Miami. I'm here in Atlanta for the American Society of Hematology meeting. We have one more day to go on the meeting, but already it's been an incredibly exciting meeting. First of all, over the last 2 or 3 years, there's so many new treatments for the hematologic malignancies or blood cancers. And what we're hearing today is not only about how these drugs can be used by themselves, but we're beginning to learn how they can be combined with some of the existing treatments. The plenary session was held yesterday, and it had some incredible abstracts that were presented, potential new treatments for Hodgkin's disease, for systemic mastocytosis, and what's also been very important in this meeting is the development of algorithms to understand what drugs should be given first to which patients. So for instance, in CLL, chronic lymphocytic leukemia, stratifying patients based on whether they have a normal p53 gene or a mutant p53 or deleted p53 gene, and using that as the basis for starting with the initial therapy, and then also the thinking about relapse disease or refractory disease and where to go with the targeted therapies. We also have more antibodies, not only directed specifically against cancer, but also bispecific antibodies. Looks very exciting. New ways of getting the immune system to recognize cancer. And lastly, I would say in the CAR T cell space, the chimeric antigen receptor T cells, heard some very interesting data about targeting multiple myeloma cells with a myeloma antigen, and also understanding how we can get over the pancytopenia in terms of treating some of the myeloid malignancies. So there's now some novel approaches there. On the scientific side, we hear some new enzymes that seem to be very important in treating cancer. Sarah Greenblatt from Sylvester presented about CARM1, which is a protein arginine methyltransferase that seems to be critically important in leukemia and to play very little role in normal hematopoiesis, suggesting a very important therapeutic index, little activity against the normal cell, profound activity against cancer. And so as we think of all the new laboratory techniques, the Wasserman lecture, the Damashek lecture, many of these lectures are about technology that people have used to investigate leukemia and similar diseases. And now those techniques are being broadly applied to a variety of cancers, whether it be indolent lymphoma and CLL or some hairy cell leukemia. And on the myeloid space, AML, MDS, myeloproliferative diseases, we are not only having second-generation treatments, but third-generation treatments. And for instance, in the tyrosine kinase space, not only new drugs, but drugs that target the specific mutations. And so we have never had this many new drugs, both FDA approved and in the pipeline, and it's just a very exciting ASH meeting this year, and we look forward to seeing some of the follow-up data on the incredibly exciting things that are presented here.